Welcome to the third video in the Domestic Violence and Abortion Care series. This module, entitled Reproductive Coercion and Forced Abortion, Practice Tips for Medical Abortion Providers in Enhancing Women's Reproductive Autonomy, provides tips for practitioners in supporting women to gain reproductive autonomy by identifying and responding to coerced abortions. Coerced abortion is a part of reproductive coercion, sitting within the definition offered in the previous video in this series. It is any perpetrator behaviour aimed at establishing and maintaining power and control over a woman who they are, were or seek to be in a relationship with by interfering with her reproductive autonomy. Strategies may include denying her control, decision-making and access to options regarding reproductive health choices. Perpetrator behaviours are more commonly those of pressure to not become pregnant, for example threats of consequences, and pregnancy outcome control. Forced abortion speaks to a different set of perpetrator objectives, but is still ultimately about control. It can be about keeping the focus of the relationship on the perpetrator's needs, spiritual abuse to force the woman to go against her own moral and religious beliefs, having something to use as a threat. For example, if she leaves him, he will disclose the abortion to family and community who may disown her as a consequence. And depriving the woman of the attention and importance that pregnancy and motherhood might bring. As an abortion provider, it is important for you to understand that coerced abortion tactics are often relentless and multifaceted in the lead up to the appointment. It is not necessarily just presented in the form of the perpetrator attending appointments with the woman. The perpetrator will draw on other forms of violence and control, such as physical, emotional, psychological, economic, spiritual abuse and control. The woman may attend your practice on her own, but the work of the perpetrator will have already been done in wearing down her resolve and her sense of personal rights and personal agency. Other people attending appointments with the woman may be enlisted by the perpetrator for their ends. The perpetrator may not be the man involved in the pregnancy. It could be a relative or a friend. For these reasons, it's important to always see the woman on her own at some point in each of your contacts with her, and to ask her directly if anyone is forcing her to end the pregnancy when she does not want to. Sometimes the woman's decision about the pregnancy may align with the person who is coercing the abortion, but she may feel she does not own the decision. You can help her identify what is important to her in this decision versus what has been imposed or enforced, so she has a stronger sense of peace and personal agency in the experience. A referral for pro-choice, pre-abortion and post-abortion counselling may also support this. An abortion for any woman can be unfamiliar, anxiety-provoking and emotionally charged, so the presentation of women experiencing coerced abortion can be really hard to pick within this milieu. It could range from numb and emotionless to highly distressed. For this reason, it is important to ask about the meaning behind the emotion, or lack of it, and to ask directly about whether they are being forced into an abortion against their wishes. Perpetrator presentations at the clinic may range from highly agitated to overly kind, often described as the street angel house devil. The perpetrator may want to follow the woman through each step of the appointment and may do most of the talking when included in the appointment. Listen to your intuition. If you are concerned there may be coercion, take charge of the session. Use your authority to provide space for the woman to be heard, even if this means asking or directing the man involved or others to return to the reception area while you continue your consultation with the woman on her own. Where you suspect forced abortion, it may be important to explicitly explore the consequences of her not having an abortion on that day. For example, you could say, "I am worried about whether this is what you really want. If we were to send you away today without doing the procedure, how would that be for you? Are you worried about how the man involved in the pregnancy or others might react to this?" If you are concerned about her safety, it may be important to consider referring the woman to a specialist domestic violence service for further risk assessment and safety planning. You may find it helpful to download the DAISY app to your consulting room computer. This app and the 1-800-RESPECT website can be used to locate the specialist domestic and sexual violence service nearest to your patient. Some men may use both coerced pregnancy and coerced abortion in their practices of intimate partner violence and control, so it is insufficient to just ask about one. The previous video in this series looks more closely at the issue of coerced pregnancy. Because of the nature of forced abortion tactics, even the most skilled of us may not detect or prevent every forced abortion, but the steps you take to explore the issue still contribute to the woman feeling cared for.